Welcome to Vet Ranch. I'm Dr. Wendy, and this is our newest patient. This is the shelter named her Knotty. As you can see, she's kind of full of mats and knots, so they're thinking about trying to find a different name for her. She was found wandering the streets. She's definitely an older girl, and right now her biggest issues are, come here, Knotty. She's got a very large growth right here. I'm not exactly sure what it is, but she also has a mammary tumor back here. So we're gonna try to get her all cleaned up, get that removed. We did blood work on her. Her blood work actually looks really good. No other diseases going on that we know of. Heartworm test was negative, so that's all good. And she's just a sweet little girl. Yes, yes. And then we did do a chest x-ray as well, just to make sure she didn't have any kind of tumors in her lungs. As far as with mammary cancer, we see that quite often. So we did double check that. So keep you updated. Alright, so it's been a week since we had this little girl come in, and I think we've changed her name to Pamela. She has gotten a bath. I think she's going to get a haircut, and she's going into surgery today, so we're going to definitely remove the mammary mass. I think the plan is to try to remove this large mass down here, and then we may end up spaying. I don't know if that's all going to be too much at once, so we may break this out into a couple different surgeries, but we're going to get started, so we'll let you know how it goes. Alright, so Pamela is hooked up to the anesthesia machine. So this is that large growth there, and then this one I'm actually probably more worried about. This is like a large mammary mass, I think, so we're going to get these off, and then we'll have to go from there. There we go. Okay, so this is Pamela after surgery. Kind of trimmed up her hair. We'll finish it off after her spay. It's like a brand new dog. She's still a little sleepy from surgery. Pamela. Oh, poor baby. Hi. Oh, I know you hate your comb. Come here. Goofy. You're silly.
Okay, so these are the sutures from her growth removals. As you can see, everything has healed very nicely. So we're gonna head and remove those and then spay her, and then she'll be good to go. Okay, well, Knotty is spayed. Pretty routine surgery. We got all of her sutures out. So she is good to go now.
Okay, so this is our last video. This is our final one on Knotty. So she has been taken care of. We removed that large lump on her chest. That was a lipoma, so just a fatty growth. We also removed that mammary mass that was on her abdomen, so that has been taken care of. She also has been spayed. The path report on that mammary mass did come back as cancer. So unfortunately, these dogs, when they're not spayed, that's kind of what it leads to oftentimes. So really for her, she's still comfortable. We removed that mass. There's no evidence that it's in her lungs or her lymph nodes at the moment. So really now she's just gonna live out her good days. And hopefully that's still several years, so we'll just have to kind of track that. She's just sweet as can be, and she's gonna hopefully find a great home and enjoy the rest of her days being spoiled. And thank you again for all of your donations to Abandoned Pet Project. We could not do this without y'all And you know, you make our dreams come true by getting to save these animals. Thanks again.